Thank you very much. Let me start off with a question for Ms. O'Connell and Dr. Walensky. Nobody can predict what the next public health emergency will be. But in a sense, our job, and more specifically your job, is to put us in a position where we can react as effectively as we can so we don't lose over 1 million people next time around. So my question is a pretty simple question, and maybe Dr. Califf can jump in as well on this one. Are we moving forward right now? Can you tell us confidently that we are moving forward as fast as we can with creating the kinds of vaccines we may need in anticipation of the next pandemic? Do we have the kinds of treatments? Are we moving? I know you may not have them today, but are we moving aggressively forward to have the treatments that we need if people become ill? Do we have the workforce infrastructure that we need? Are you confident in telling us that you can move rapidly when you learn that that we are facing a pandemic, and that you could rally all the resources that you need? Do we have the medical personnel to staff our hospitals if, God forbid, we find ourselves in the same position again? So, Ms. O'Connell, can you start off with that, please?
Chair Sanders, thank you so much for this question. This is one of my biggest worries, is that we are losing time in preparing for the next pandemic. It's the reason why the administration requested $88 billion last year to advance the American Pandemic Preparedness Plan. We did not receive that funding. We've requested again in our FY24 budget $20 billion, of which 10 would go to BARDA, to begin that research into the prototype vaccines, therapeutics, and diagnostics for those 7 viral families most likely to cause the next pandemic. You know, we were so lucky, I know it doesn't feel like it, but the one place we were lucky when it came to the coronavirus is we had already done a lot of the early work on that because of SARS and MERS. We need to get the same head start.
Are you telling us that we have not done the kind of work you would like to see us done in preparation for what may be coming?
Correct, not in all the viral families.
Okay. Dr. Walensky?
Thank you for that question, Chair Sanders. So we started with a very frail public health infrastructure from decades, in fact, of underinvestment. Some have estimated we have 80,000 public health work jobs in deficit right now. In fact, your own state of Vermont hired 120 people during the COVID-19 pandemic, and through our workforce infrastructure, you're able to retain, our workforce infrastructure grant, you're able to retain 12 of those 120. So it just gives you a sense of how frail and of the workforce infrastructure. In addition to the vaccines...
Let me interrupt you. Are you concerned that so many doctors and nurses are leaving the profession for a lot of reasons, but including the burnout and the stress they experienced during COVID?
And public health workers, deeply.
Yeah.
Yes, deeply. I will also note that...
I don't mean to be interrupting you all the time. What ideas do you have as to how we can rebuild that critically important workforce?
So much of the workforce authorities that we are looking for in public health specifically, things like tax-exempt loan repayment to entice people to come in. We know our laboratory...
Can't we do a little bit better than tax-exempt loan repayment? We have a massive workforce shortage. We need thousands of new workers.
Indeed, we do. And many of these physicians, for example, come out of medical school with $200,000 worth of debt.
So that seems like a very modest... Too modest.
And direct hire authorities, flexible pay, danger pay, for example. I have colleagues in Equatorial Guinea right now on the front lines of a Marburg outbreak, and they are not getting danger pay. So these are the workforce things that we need to do to entice people to come into health and public health. So those are many of the things that we're asking for as part of this reorganization.
So what I'm hearing you say is, despite good intentions, your agency is not as prepared as it should be if, God forbid.
I would agree with that, yes.
Okay. Dr. Califf?
What I'd say, Senator, is that when it comes to technology, we are unsurpassed and ready to go with regard to drugs, devices, vaccines, tests. But when there's a profit to be made, the American industry is premier and goes for it and is producing amazing things. For the public health, we have a gap in translation, which is what my colleagues here are referring to. When there's not a profit at the end of that pipeline, We need to have the funding in order to stimulate the industry to produce these products that we're going to need for the future. And as a former practicing doc until very recently, I'm very concerned about the thing that you all referred to, and I want to stress the public health workforce, not just the docs and nurses. You lost a very important person yesterday. This is not, and it's emblematic of how hard this work is. We are way down in the workforce that we need across the board to implement. Just talk to any of your friends trying to get an appointment in a clinic, particularly in mental health these days.
Okay. Senator Cassidy.
I will defer to Dr. Marshall.
Thank you, Ranking Member and Chairman. Dr. Walensky, if